Thank you very much for this very kind introduction and invitation to present in the 26th March iTRUE webinar. I congratulate Mr. Ninda Kumar for his efforts for teaching and training of colleagues in urology. So I'm going to focus on advances in technology with the miniaturization of the percutaneous nephroscopes and particularly focusing on the stone retrieval. I am Hammad Ather. I'm professor and head of urology at Aga Khan University in Karachi, and this is where I work. So if you look at the recent guidelines, and these are the ones which have very recently been issued a couple of weeks back on urolithiasis, things have not changed over the last many years. We still see that SWOL, RIRS, and miniaturized PCNL in this order are considered as the options of treatment for up to 20 mm stones in the kidney. If you look at the data between the recommendations for less than 10 mm and 10 to 20 mm stones, SWOL is considered as a first-line option for smaller stones and also for stones in the 10 to 20 mm category, whereas endourology with RIRS and PNL has other options. For lower polar stones, again, if the anatomy is unfavorable, endourology is considered as an option. If the anatomy is favorable, then SWOL is an option for up to 20 mm stones, even in the lower pole. So these are interesting recommendations, and I'm sure things will change as the endourological revolution brings in more sophisticated equipment for stone clearance. One of the problems that we face with RIRS, which is considered as now the new workhorse of endourology for small and moderate sized stones, is that sometimes you need multiple procedures, or at least you need one procedure for placement of stent. Stenting post-procedure is again something which is a bit of a bother for patients. Per-operatively, we see that longer operating times can result in significant rise in intrarenal pressure and related complications. Use of laser, as we know now, that increases the temperature and can cause thermal damage to the mucosa. The higher equipment and disposable cost is another important factor, but more importantly, the stone clearance, particularly with the stone, so-called stone dust, which is sometimes more than the dust itself, is a bit of an issue with RIRS. The percutaneous procedure, which is until now reserved for larger stone burden, have seen significant technological advancement since its first introduction about 80 years back, over 80 years back, by Rappel and Brown, who first described removal of a kidney stone using a cystoscope, using a 26 French cystoscope. It wasn't until 35 years later that Funstorm and Johansson first removed a stone and performed a procedure which we now call or recognized as PCNL. The German urologist Peter Alken developed 20 and 30 Charrier nephroscope with Karl Storz, a German endourological manufacturers. Hillel, probably about 24 years back, entered us into the era of modern MIS with miniaturized PCNL when he used a pediatric cystoscope to remove stones using a 10 French cystoscope. And since then, we have seen one innovation after the other, so much that now we have as fine equipment as a 4.85 French micro PCNLs or micro perc. We're using a 0.9 mm nephroscopes. So that's really amazing evolution of technology over the last so many years. I'm going to talk about two procedures and particularly focus on the fact that how they utilize the system to retrieve stone fragments. And so end of the procedure, you are completely stone free. You can do a CT scan within 15 minutes, which show no stone fragments. And these two procedures are the one described by Dr. Zhang from China. This is called Super Mini PCNL. And this utilizes a 14 French outer sheath and a nephroscope, which is specifically built to have irrigation channel as well as suction channel. And the suction is attached to negative pressure. The whirlpool created by this irrigation channel, which is in the outer part of the external sheath, creates a little whirlpool which pulls the stone fragment into the inner sheath, which is a wider bore part of the outer sheath. And this is attached to a suction, and this suction device can actually retrieve all these fragments so that at the end of the procedure, you have absolutely no stone left. Now, for stones which are larger and what cannot be sucked in, what you need to do is to withdraw your nephroscope, and these stones then can come up to the angle where these stones are sucked into the negative irrigation bottle. End of the procedure, what can happen is that the stones are completely removed and all stone fragments. Typically, they don't require any internal or external stenting. A very similar procedure is described by Dr. Desai and colleague with using a German manufactured scope called an Ultra Mini PCNL, which again is a similar device, which also utilizes a form of a suction system. This is an end-on view. The smaller hole is for the 1 mm nephroscope, and the outer sheath, which is a bigger lumen, is for the suction and irrigation of these stone fragments. So this nephroscope, which is a 1 mm telescope and suction and irrigation system, is introduced into the kidney. You can use a 365 micron laser fiber to fragment all the stones. And these stones are then ultimately sucked back into the system using the innovative device, which creates a little whirlpool, and subsequently all the stone fragments are retrieved back into an end of the procedure, patient stone free. So typically they don't try to dust the stone, they try to break it with little fragments, and these fragments are up to 2 or 2.5 mm, and they can be easily retrieved. So in summary, Ultra Mini and Super Mini PCNL provides technological advancement for safe and effective fragmentation, removal of small to moderate sized kidney stones, and all this can be done in an ambulatory setting, which is really ideal